This is the pre-public health information session video for main campus University of Arizona students. This video contains sound. Be sure your audio is on to obtain all answers for your worksheets. We acknowledge that the University of Arizona campus is situated on the traditional and ancestral territory of the Tohono O'odham people. During this video, we'll talk about what is public health, advising information and tips, admission information, curriculum breakdown, and study abroad opportunities. Welcome to Public Health. Over the last 10 years, Public Health has graduated many students who got their start in other U of A programs. In fact, 80% of students graduating with a degree in Public Health started in a different major, so you're in good company. If you're looking to do any of the following, switch majors into pre-public health, declare pre-public health as a second major, declare pre-public health as a second degree, or meet with an academic advisor, you must have a 2.5 GPA, watch this video in its entirety, complete the information session worksheet, complete the curriculum worksheet, and submit both worksheets to your public health academic advisor. So what is public health? Public health is a diverse and ever-expanding field. Among other things, it involves disseminating reliable information for policy decisions, identifying systemic inequalities and problems, protecting our health and safety through education and research, and fostering partnerships with individuals, communities, and organizations to promote good health. Sometimes we like to break it down to the 4 Ps: prevention, promotion, protection, and population. Prevention is the big idea in public health. We aim to improve people's quality of life by focusing on health promotion and disease and injury prevention. Think proactive instead of reactive. Public health promotion focuses on socio-cultural factors that influence health and health behavior. Through planning, implementing, and evaluating effective public health education, health promotion, and disease prevention programs, the goal really is facilitating behavior change for a healthy life. The elimination of smallpox, stricter automobile and workplace safety standards, increased awareness about the dangers of smoking, and information on nutritional value of foods are all attributable to work done in the field of public health. According to the Centers for Disease Control and Prevention, advances in public health are responsible for lengthening the life expectancy of Americans by 25 years in the 20th century. Population. Public health practitioners carry out their mission through organized efforts that draw upon knowledge from many disciplines to address the physical, mental, and environmental health concerns of whole communities and populations. So what can you do with a degree in public health? You can pursue work or graduate study in public health, specifically in epidemiology, healthcare administration, health policy, health education, biostatistics, environmental and occupational health, and many more. You can also choose to pursue work or graduate study in a helping profession. Some of those might include medicine, nursing, pharmacy, physician's assistant, physical therapy, occupational therapist, dentistry, optometry, and so many more. In the next section, we will talk about advising and academic resources. The Office of Student Services and Alumni Affairs for Public Health is located in Jackman Hall, room A302. That's on the 3rd floor of Jackman Hall. The College of Public Health is on the A side of Jackman Hall, not the B side of Jackman Hall. The B side of Jackman Hall is actually the College of Pharmacy. So who is your public health advisor? Public health advisors serve students based on their campus and last name. You can find your advisor on Wise Advising, UAccess Student Center, and on publichealth.arizona.edu. Advisor availability. The Office of Student Services is open from 8 a.m. to 5 p.m. Monday through Friday. Advisors, however, are not available for this entire time. You should expect a 24 to 48-hour email response time from your advisor, depending on the time of year. How to see an advisor. Public health advisors meet with students via walk-in quick advising hours and by appointment. Walk-in quick advising, you can find the available times for walk-in advising on Wise Advising. During quick advising, you'll meet with a public health advisor taking walk-ins during that time. And walk-in advising sessions are only 15 minutes long. Advising appointments can also be found on Wise Advising. You'll meet with your assigned academic advisor by your last name, and these appointments are usually 30 minutes long. The College of Public Health website is a wealth of information for public health students. On our website, you can access resources like our curriculum guides, 4-year plans, applications to the major, internship policies and tips, information about our ambassador program and our student clubs, and so much more. In this next section, we'll talk about pre-major and major admission. As a reminder, you start as a pre-public health major and you graduate as a professional public health major. Declaring pre-public health. This is what you're doing right now. In order to do that, you must have a 2.5 GPA, watch this video in its entirety, complete the information session worksheet and curriculum guide, and submit both worksheets to your public health academic advisor. Later on, you will apply to the professional public health major. Why would you do that? Because then you can begin taking 400 level classes and also qualify to apply for college-specific scholarships when you're admitted to the professional major. When should you consider applying to the professional major? This is something you definitely want to talk to your advisor about, but in general, you should make sure you have a 2.5 GPA, you have 5 or fewer units of outstanding pre-major prerequisite coursework to complete, and then you'll complete a professional major application, submit a resume, and submit a statement of objectives. As a reminder, students may take 100 to 300 level public health courses as a pre-public health student. The 400 level courses are reserved for our fully admitted public health students. There is a differential tuition that you will be charged per unit once you've been admitted to the professional major. In this next section, we'll review the public health curriculum, all of the courses required to graduate with a bachelor's degree in public health. The things you should have open during this section are your public health curriculum guide and also your UAccess course history to help you fill in the courses you've already completed towards our degree. The public health curriculum starts on page 1 of the worksheet with the pre-major prerequisites. Your pre-major prerequisite courses should be your first priority as a pre-public health student. Each class listed here must be completed, and it must be completed with a grade of C or higher. The list includes first and second semester English composition, second language at the second semester proficiency level, college algebra, so Math 112 or higher is required. Your chemistry sequence, you should talk to your advisor about which sequence is appropriate for you and your future goals, but you will need 2 semesters of chemistry. You'll need a general biology lecture and lab, and then you'll also need introduction to public health, personal health and wellness, and an introduction to nutrition course. The next section is general education courses. We require 6 general education courses, and each course must be completed with a grade of D or higher to count towards your degree. We require 2 individuals and societies Tier 1 150s courses, 2 traditions and cultures Tier 1 160s courses, 1 Tier 2 arts or humanities course, and 1 Tier 2 individuals and societies course. Please note that PHPM 310, HPS 387, and HPS 300 cannot be used for your Tier 2 individuals and societies requirement as a public health major. You must choose a different course to fulfill that. On the second page, we move on to the public health core 1 and 2 courses and the public health internship. These courses must be completed to graduate with a degree in public health, and they all must be with a C or higher grade. On this page, you'll notice in the Core 1 box, these are all 300 level courses that you can complete as a pre-public health student if you choose to. We start with 1 semester of anatomy and physiology, 1 upper division English course listed there. You need an our introduction to epidemiology class, healthcare in the US, principles of health education and health promotion, introduction to environmental and occupational health, introduction to biostatistics, and health disparities in minority health. After this point, it looks like it would be time for you to apply to the professional major because from here on out, they're all 400 level courses. So Public Health Core 2 is your 2 400 level Public Health Core courses, Global Health and Public Health Nutrition. And then finally, the bottom of the page talks about the Public Health Required Internship. This is a 6-unit required internship that you should talk with your advisor about planning, usually around senior year. On the next section is public health subplans. We have 4 public health subplans, and you'll choose one of these subplans and you'll complete 12 units in that subplan with a grade of D or higher to graduate. We'll talk about what the subplans are on the next slide. So the public health subplans are environmental and occupational health, health promotion, health systems theory and practice, and global health. When you get close to applying to the professional major, I highly recommend reaching out to your public health advisor to discuss your strategy on which subplan to choose based on your future goals, your graduation plans, and your interests. The next section is public health electives. You'll need to earn 9 units of public health elective with a grade of D or higher. You can choose any 300 to 400 level public health course that you're not counting towards your track and count those units towards your public health elective requirement. So in addition to the courses you see listed here, you can also choose other 300 and 400 level public health courses. For example, some of the track or subplan courses on the previous page. In addition to those options, you might consider some of the options listed towards the bottom of this page, such as being a preceptor, doing directed research or independent study with a faculty member in public health, or even doing additional internship units as elective internship units. All of those opportunities give you some flexibility with how you earn these public health electives rather than just taking additional coursework. Finally, some students will need to place some classes here in this general electives section, and many students fulfill this section with additional units they need to complete as prerequisites for graduate studies like medical school. The bottom line is you need at least 120 overall units to graduate with your bachelor's degree, and this section helps students get to that number if they need additional units. Public health study abroad. In public health, we encourage students to study abroad to fully understand the global nature of public health. Currently, there are 4 public health faculty-led programs. The first is our program in Peru. This is a 10-week summer program in Cusco, Peru that offers undergraduate public health students the opportunity to do a full semester of core public health coursework and engage in service learning in a global setting. Our program in China is a 5-week program where students spend time in China learning about traditional Chinese medicine, martial arts, and other unique subjects. We also have a program in Tanzania. This program focuses on global health and global water, sanitation, and hygiene, and provides an opportunity for students to learn about global health issues within the context of a developing country. Finally, we have our Northern Europe program. This program examines how issues related to sexuality are addressed in Belgium, the Netherlands, and Denmark. Students will spend 1 week in Tucson and then 3.5 weeks in Europe visiting hospitals, public health agencies, and universities, and interacting with local students, governments, researchers, medical professionals, and public health workers. In addition to the 4 public health faculty-led programs, there are also many other university-wide study abroad opportunities, so we encourage you to visit the studyabroad.arizona.edu website to find other opportunities, and make sure to talk with both a study abroad coordinator and your public health advisor when you're making your plans to study abroad. So don't forget to complete the information session worksheet, complete your curriculum guide, follow the instructions on our website on how to get these documents to your public health advisor, and then wait 3 to 5 business days to receive an email confirming pre-public health has been declared on your account. This concludes our pre-public health major information session. We look forward to hearing from you soon.